this movement analysis video, we will be explaining the muscles used to prepare, execute and follow through for a basketball free throw. A basketball free throw is an unopposed attempt to score points from a restricted area on the court, known as the foul line, and is generally awarded after a foul on the shooter by the opposing team. Our aim when preparing, executing and following through with a free throw is to accelerate the ball upwards and towards the basket.
Preparation phase. In the trunk, the concentric contraction of the rectus abdominis muscle is working with the internal and external obliques to flex the torso in the sagittal plane and frontal axis. Execution phase. When the trunk moves from its flex position to extension in the sagittal plane and frontal axis, the upward movement of the trunk will push down on the lumbar vertebrae, pushing down on the sacroiliac joints, which in turn will push down on the body's hip joints. The trunk is extended by 5 main muscles: the iliocostalis, longissimus, spinalis, quadratus lumborum, and sacrospinalis. A deeper trunk extension produces added hyperextension at the neck area, helping the shooter to retain the focus on the rim. The splenius capitis and cervicus bilaterally contract concentrically to extend the neck backwards. Follow-through phase. The trunk is slightly rotated away from the shooting right hand by the contraction of the right external and left internal obliques. This helps in lining up the shooting shoulder and arm with the rim. This slight trunk rotation happens at the moment the ball is released from the shooter's hand.
In the preparation phase for the upper limb, the ball is held stationary at waist level with the shooting arm behind the ball. The shoulder girdle is depressed with the shoulders facing toward the basket. The shoulders are flexed using the anterior deltoid, the biceps brachii, and the pectoralis major. The forearms are pronated with the elbow flexed using the triceps brachii and aconius to support and stabilize the elbow joint and stop the forearm from falling backwards. Wrist extensors such as the extensor carpi radialis longus and brevis and extensor carpi ulnaris cause the hand to go back toward the upper arm in order to support the ball and be in position to provide a propelling force for the shot. The abductor pollicis longus and brevis cause the fingers to abduct to hold the ball.
As you move from the preparation phase to the execution phase, your posterior arm muscles such as the triceps and aconius concentrically contract to produce elbow extension. The biceps brachii and brachialis move from concentric contraction during elbow flexion to eccentric contraction during elbow extension. The anterior deltoid and coracobrachialis contract concentrically to flex the shoulder joint upwards. The flexor digitorum profundus and flexor digitorum superficialis are concentrically contracting to allow your proximal and distal interphalangeal joints to flex to be able to grab the ball. To release the ball, your extensor digitorum concentrically contracts, which extends your interphalangeal joints to release the ball. This action is happening on the sagittal plane around the coronal axis.
Preparation phase. The ankle extensors act similarly to the hip and knee extensors during the free throw motion. These lower leg muscles lengthen during the downward movement phase and shorten during the upward movement phase. During the preparation phase of the free throw, the hips will be flexing, which will lead to the gluteal region, which includes the muscles gluteus maximus medius and the semitendinosus, the semimembranosus, and the biceps femoris. All movements in the preparation phase move on the sagittal plane. As you squat down, you will notice the knee flexing, which in turn eccentrically contracts the lataris vastus, medialis, and intermedius vastus. The purpose of flexing your knees is to allow power to be generated through your legs to propel your body upwards. Execution phase. The quadricep muscles extend your knee joints, increasing the angle between your lower and upper legs. These include the rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis muscles, which are in front of your thigh. The quads contract eccentrically as the muscle fibers lengthen as you flex your knees to prepare to shoot a free throw, and then concentrically as the fibers shorten to extend your knees just before you release the ball. This movement produces momentum that helps you propel the ball to the basket. The hip extensors, which includes the gluteus maximus and the hamstring muscles, play a similar role as the quadriceps when you shoot a free throw. They contract eccentrically during the downward movement phase of the free throw motion and concentrically during the upward movement or shooting phase. Thus, your hips flex and extend consecutively, just like your knees.